This is what it looks like when more than 3 trillion liters of water fall over 5 consecutive days. Many areas in Houston and elsewhere flooded. The water is toxic, and downed power lines can mean instant death in southeast Texas. Andrew Pasick returned to his family's neighborhood to look for a pet cat. He was electrocuted in his family's yard.
They couldn't even help my son. They couldn't resuscitate him. He was in electrified water.
At least 2 volunteer rescuers were electrocuted when their boat hit underwater power lines. And there are other hazards. People who fled their homes are without life-saving medications like insulin. The Centers for Disease Control and local hospitals are helping out. But with lots of water and daytime temperatures in the 30s, Houston is a perfect breeding ground for mosquitoes and bacteria.
The public health concerns following Hurricane Harvey go way beyond the immediate flooding and rainwater. The concerns extend to mosquitoes and the diseases they carry when standing water is available, especially in containers. Mental health is a concern. Mold growing in damaged homes is a concern.
There are concerns that people exposed to floodwater can develop multi-drug resistant staph infections or E. coli, bacteria that can kill.
If wastewater treatment facilities are overwhelmed, there's potential for sewage to get into the water. And then there's the drinking water that comes out of the tap, which is threatened as well by flooding that's limiting the activity at one of Houston's drinking water treatment plants right now.
As the water recedes, mold and respiratory problems due to mold can increase. Water-soaked walls, insulation, furniture, and carpeting can cause illness or even death. The CDC and public health officials can help address these problems. But for some, the worries could result in lasting trauma, especially for those who saw family members or friends perish, and for those who lost everything they had.
We won't have a home to go back to.
Carol Pearson, VOA News, Washington.